All right, guys. So today is somewhat of a milestone for the voice to Parliament in Australia. It has actually, the plan has passed the Senate, meaning that the voice to Parliament referendum vote will actually happen before the end of this year. So it is somewhat of a milestone. And the reason I'm bringing this up is because I'll come back to this later. But the main story that I wanted to discuss today was what's happening in New Zealand, this story that I saw today, which is from the New Zealand Herald. And I'll just read this story and then I'll come back to discussing the voice to Parliament in Australia. So, New Zealand Herald has here, Auckland surgeons must now consider ethnicity in prioritising patients for operations. Some are not happy. Auckland surgeons are now being required to consider a patient's ethnicity alongside other factors when deciding who should get an operation first. Several surgeons say they are upset by the policy, which was introduced in Auckland in February and gave priority to Maori and Pacific Islander patients, on the grounds that they have historically had unequal access to healthcare. Health officials stressed that ethnicity is just one of 5 factors considered in deciding when a person gets surgery, and that it has an important step in addressing poor health outcomes within Maori and Pacific populations. The Wataoro Health New Zealand has introduced an equity adjuster score, which aims to reduce inequity in the system by using an algorithm to prioritize patients according to clinical priority, time spent on the waitlist, geographic location, ethnicity, and deprivation level. In the ethnicity category, Maori and Pasifika are top of the list, while Europeans and other ethnicities like Indian and Chinese are lower ranked. Now, before I continue on with this article, I'm not from New Zealand. I've done a bit of basic research on the laws in New Zealand, and I did find they actually do have, because when I was reading that, I was like, it sounds like discrimination of some sort. So I did look up and I found that New Zealand does indeed have a Human Rights Act, which covers discrimination on the grounds of color, race, ethnic, or national origin. So, by law in New Zealand, you cannot discriminate based on these attributes. But let's go back to the article and keep reading. Some surgeons who spoke on the condition of anonymity said the new scoring tool was medically indefensible. They said patients should be prioritized on how sick they were, how urgently they needed treatment, and how long they had been waiting for it, not on their ethnicity. One of the surgeons said he was disgusted by the new ranking system. It's ethically challenging to treat anyone based on race. It's their medical condition that must establish the urgency of the treatment, the surgeon said. There's no place for elitism in medicine, and the medical fraternity in this country is disturbed by these developments. A document on the equity adjuster, which was leaked to New Zealand, said shows two Maori patients, both age 62, who have been waiting for more than a year, ranked above others on the list. A 36-year-old Middle Eastern patient who has been waiting almost 2 years has a much lower priority ranking. And look, it keeps going on here. Let me just read this email that they sent, actually. So this is an email sent by the New Zealand Department of Health, I'm guessing, business support manager. And the email read, "Hi team, heads up. This is going to be a new criteria for outsourcing your patients going forward. Just putting this on your radar now so that you can begin to line up patients accordingly. Over 200 days for Maori and Pacific patients, over 250 days for all other patients." Yep. I think this is the health minister in New Zealand. But yeah, look, as you can see, clearly there's some people in New Zealand, surgeons particularly, who are talking about how this is, ethically, this is questionable as well. Like when someone comes to you who is sick, who needs surgery, if you start ranking them based on ethnicity or race, that seems very problematic in our Western nations, right? Now, of course, a lot of these must usually come about because there is disparities in health outcomes for different types of people based on social economic status, or based on, potentially in this case because they're indigenous, or there's lower outcomes for them in the healthcare system for whatever reason, health reasons, could be anything, right? But then the systems the governments are putting in place, the wording and the way that it's designed is actually based around race. And then that actually ends up excluding people Okay, they can debate this all they like with their fact checkers, but it does actually end up excluding people and separating people around race and ethnicity. So that's the problem. And in Australia, we're having a similar discussion right now with the voice to parliament, and what that will mean for different parts of our society. Now, at the moment, it's being portrayed, even though there's very little detail, and even if you say that, the fact checkers will come after you. Even though it's very little detail on how this will actually operate in terms of the type of power they will have, the advisory body itself can make certain recommendations. And I was also trying to find out in New Zealand how this all came about. And of course, the discussions that I saw in New Zealand that were happening have been happening for a long time around the health outcomes for Indigenous Maori or Pacific people in New Zealand. So this is not something that's happened overnight as such, but over a long period of time, these things have become more and more ingrained within the society in that country, to a point where the government is now comfortable with having this very out in the open in terms of the way that they are administering their health services based on race and ethnicity, particularly for surgeries in New Zealand. So yeah, look, it's some food for thought. I'm not, again, because of the fact checkers, I'm not making a direct comparison between Australia and New Zealand when it comes to the voice to parliament. You got to be careful, because these fact checkers, you can't make these comparisons, because you're attempting to confuse people about different things, and there's different system in New Zealand and all this kind of stuff. So you got to be very careful in how you term this. So I'm aware of you fact check clowns, but the truth of the matter is, we are very similar in many ways to New Zealand in terms of a Western liberal democracy, and in terms of our ideas around how everyone is equal. But equality sometimes in our modern world doesn't actually mean what it means, right? Sometimes it's more about these equitable outcomes based on specific characteristics. And that is what we're seeing here. So what are your thoughts? Do you think, are we like, should we not be comparing these two things, right? Is the voice to parliament and whatever's happening in New Zealand right now something completely unrelated? Or do you, like me, are you suspicious that we could potentially be finding ourselves in Australia in similar situations, right? Do we need more clarity for our government on this? Like, do you want to have a country like in Australia where if you are of a certain, if you're white or if you are an immigrant, that you are ranked lower when you need, surgery, as opposed to an Indigenous person, because they're trying to rectify historical things which may have happened, right? Historical injustices is the way that's been termed for the rules in New Zealand. So tell me what you think, and I'd love to hear your thoughts. I think this is all kind of pointing in a certain direction for me, and that's kind of how I see it. Anyway, guys, if you enjoy my videos, please feel free to follow along at The Real Rukshan on YouTube, Facebook, Instagram, Odyssey, Rumble, and of course on Twitter at The Real Rukshan. And see you next time.